Hi guys, Tom Morrison here, and I want to go over elbows and sort of pains that you get. So golfer's elbow, tennis elbow, tendonitis, just cranky elbow in general. A lot of the times it's not so much the elbow that's to blame, it's either going to be your wrist or your shoulder that's going to be the problem. So with the wrist, a lack of training both with flexion and extension is going to create tightness up the forearm, which is going to pull at the elbow, so that's why you'll get that sort of pain with any kind of elbow movement. So it's nothing to do so much with the elbow, it's more with the wrist. Also, if your shoulder is slightly sitting too far in front, then you're not going to be pressing in the right way. Things are going to have to rotate slightly for you to press straight, and then that's going to give you that pain, that hinge point. So stretching your wrists in both ways, strengthening your wrists in both ways. If you search for stronger wrists, bigger lifts on T Nation, you'll see my full article there for wrists. Everything that you need will be in that article. And then for your shoulders, make sure that you have decent thoracic extension and also that you have good shoulder flexion. Shoulder flexion is this one here. So if you can get a nice straight line all the way up and down whenever you have your arm above your head, that and your wrists are all good, generally your elbows will be okay, as long as your training is quite well rounded. So the ring rows that I post, pulling in different directions, trying climbing any sort of banded rotations, so your shoulder dislocus with the band, and also TheraBand pulls in all different directions. Make sure to use your elbow in all the ways that it can be used, and you will find that you'll avoid a lot of problems. And if you do have any problems, actually using those exercises could actually help decrease your symptoms. So it's definitely something to try if you keep getting on-off spells of it, and give it a go and let me know what you think.